Margaret Davey knew something was wrong with her eyesight when she struggled to read a street directory.
I had trouble trying to work out whether the page was 3 or 8.
After a checkup with an eye specialist, the 74-year-old was diagnosed with cataracts.
Very fortunate that the optometrist picked it up.
Margaret is one of tens of thousands of Australians living with the common eye disease.
The sort of thing that's almost inevitable as we get older, the lens naturally starts to go a little bit cloudy.
Dr Mark Delprar is an ophthalmologist who's treated thousands of cataract sufferers. He says if your vision starts to get blurry, it's time for an eye check.
They notice that they don't see fine detail clearly, so they might have trouble with night driving. They often have trouble seeing fine print when they're trying to look at a newspaper.
For cataract sufferer Sharon Cusack, an unattractive blob on her eye raised alarm bells. But at 40 years of age, she thought she was too young to have the disease.
I've just noticed just recently that even with the glasses, my eye, this eye, it's slightly cloudy and not as clear as it was before.
Young people can develop cataract, but usually in those situations it's usually an underlying cause, maybe a family history, perhaps other diseases such as diabetes, use of some medications can bring on.
Sharon's case is not yet severe, it's more cosmetic, so she has the option to delay treatment. But her eye doctor warns the condition will get worse, and if nothing's done, she'll eventually lose her vision.
So you can imagine if this lens is not clear or it's opaque, the light can't get through to the back of the eye.
It seems to be getting in the way, and I think I'll have to have it removed shortly.
So Mark, how do you know if you need cataract surgery?
They have problems seeing things in the distance, glare symptoms. Some people become very sensitive to glare. Another symptom that's quite common is ghosting or doubling of the vision.
Surgery sounds daunting.
We put an instrument into the eye. It's a little ultrasound probe that breaks the cataract up into little pieces, and we suck it out, and then we replace that lens with a new plastic lens.
But recovery time is quick. Over 95% of cases are done as day surgery under local anaesthetic.
There were no problems in it all. I'd recommend it.
Margaret had 2 separate operations to remove each cataract. After surgery, she couldn't drive home and her husband had to care for her overnight. She has to use eye drops for around a month and wear special sunglasses outside. But Margaret says she's experienced no pain since the operation and is one happy patient.
That middle distance for me is the greatest joy from this operation.
So what about the cost of cataract surgery? If you have it done by a private doctor, the price can range from $2,000 to $3,000 per eye. But if you have health insurance, you can get most of that back. Waiting time for cataract surgery depends on your level of health cover and how bad your case is. But some public patients have reported waiting for up to 10 years.
We've made a massive effort in the last few years to try and get those waiting lists down. Typically a patient would wait between 12 months, 2 years to get something done through the public system. It's very dependent on the waiting list to get into the clinics.
But in the end, the wait's worth it.
Cataract surgery is the best thing I do. It's one of the few things in medicine where you really perform a surgery on a patient and you know the patient is just so incredibly happy.
One of my greatest joys is I can read the music now without glasses and I can tell which notes they are.